So now that you've mastered the bones of the cranium, let's talk about what they look like when they are disarticulated or fragmented. So this could be a little bit more of a tricky task. So remember we talked about most anteriorly our frontal bone. So in this disarticulated example, we can actually see the remnant of what's called the metopic suture. So during growth and development, the frontal bone is actually in two pieces, and in most adults, this fuses. So that's called the metopic suture. Here you might also be able to appreciate the superior border of our eye orbits, as well as the coronal suture here, which would be associated with our parietal bones. So in the intracranial aspect, you can appreciate the dimpled appearance of the frontal bone superior to the orbits, and this has to be chipped away during dissection to access the eyeball, as well as the extraocular muscles. And in between them here is where our ethmoid bone would be, again, that crista galli and the surrounding cribriform plate for the olfactory nerve, cranial nerve 1. If we took a look at the individual ethmoid, again, it's very porous, it's very small, okay? So to get oriented here, that is going to be that crista galli. So that's going to be, again, in this region, okay? So that's going to be superior, and then the cribriform plate surrounds that, okay? And the ethmoid bone also has a portion called the perpendicular plate that is going to compose part of our bony nasal septum. Other bones that we can recognize individually include our parietal bones, again, separated from one another via the sagittal suture, right? And you can see their articular area for the temporal bone here at the squamosal suture, okay? So our temporal bones, again, okay, this would be the articulation for the temporal bone. From that lateral aspect, we can appreciate the zygomatic process of the temporal bone, which helps to form the zygomatic arch with our zygomatic bone, the mastoid process, as well as the external auditory meatus. And again, that's not going to connect with your internal auditory meatus. Okay? On the intracranial aspect, we can appreciate the petrous portion that has the internal acoustic meatus where cranial nerve 7, facial, and 8 vestibulocochlear will run through. And remember, that's hard rock-like structure. Okay. We can also see sort of a fossa for the temporal mandibular joint that's going to articulate with our mandible. Okay. In terms of our viscerocranium or facial skeleton, an individualized maxilla is seen here, and you can appreciate from the anterior aspect that it's going to house the upper teeth via the alveoli. There's also going to be an air-filled space, the maxillary sinus within this bone. And remember, this is a paired bone, and this will be our other side. Okay. Our zygomatics, or the sort of cheekbones, really small. Remember, they're going to form that inferior aspect of the orbit, and they're also going to have the infraorbital foramen for our infraorbital nerve, which is associated with the second maxillary division of our trigeminal nerve, cranial nerve 5. Okay. We also have various other pieces and parts that we can take a look at here. Portions of the orbit, for example, that contain sphenoid bone as well as palatine bone. Unfortunately, these small bones get broken easily and so are not often retained in the laboratory. Lastly, this portion represents what's called a nasal turbinate or a nasal concha, and these reside within our nasal cavity. They're sort of thin, curled bones that help to humidify the air and warm the air before it enters into our bloodstream.